now. Hi, thank you for joining me on this interview today. I'm Mita Mistry from Barfi Culture, and with me is Mayur Lakhani. He's the chair of the Faculty of Medical Leadership and Management, and he's also a GP. Thank you, Mayur, for joining us today.
It's a pleasure, Mita, and thank you for having me on your show.
That's okay, thank you. So we want to talk to you about how the pandemic is affecting the NHS and the BAME community as well. So obviously COVID-19 has changed everything. What is the biggest challenge the NHS faces right now, and what opportunities do you see for change?
Well, look, the pandemic is a very big moment for the history of medicine and the NHS. It's been absolutely tragic that so many people have died from the pandemic. I've never seen anything like this, but I think it's worth saying we should be proud of the way the NHS has coped with the massive increase in infections. The fact that intensive care was available for so many people, that so much medication was given to people. And so I think it's coped well with the surge of illness and the pandemic. Now, the biggest challenge now is the recovery, what we call the recovery from the pandemic. And that is keeping services going. So people who are on waiting lists for cancer surgery, for hip replacement, for knee replacement, people who need assessment for other ailments. So the biggest challenge for the NHS now is opening up services and opening it up safely, because you know the virus is still around, it hasn't gone away. We've got to treat patients in a safe way. You know, as a working doctor, I know many patients don't want to come forward for treatments, go to hospital or even to the GP practice because they're scared of catching the virus. So I think this has been a big moment for society, for people. I think we should reflect, take time to think through what it means. A lot of healing is needed. I know a lot of people who've lost their jobs. It's affected their mental health. This is a big, big thing. We can overcome it. We are overcoming many aspects of it. But now we need to plan how we deal with the after effects of the pandemic. The NHS has a key role in this.
Okay, thank you for that. And why do you think ethnic minority doctors were mostly affected by this pandemic?
Yes, it was so shocking and sorry about the number of deaths in young people, in older people, in mainly BME categories, I think, both in health and in care. We mustn't forget people who are working in the care sector. Now, a lot of research is going into this. It's a very, very complex matter. One thing is certain, that the disparities are striking. You know, it is a definite occurrence. The mortality rate is much higher. I think there may be some reasons why ethnic minority groups are at higher risk. For example, there's a great incidence of diabetes, of other medical conditions. Some people have cited that it may be due to vitamin D deficiency. There may be some biological reasons, such as changes in the receptor content in your throat and lungs, kidney function. Generally, Asian communities tend to have more chronic diseases and a more severe type of illness, for example, diabetes.
Yeah.
So maybe it's because their baseline health isn't as good, which is why they're more vulnerable. But there's no doubt that it's affecting BAME communities disproportionately compared to how many people work in the NHS. So more research is needed to see why this is happening.
Okay, thank you. And do you think having more representation of ethnic minority doctors at a leadership level in the NHS would make a difference?
Oh, definitely. I think there's a lot of research evidence that equality in leadership makes a big difference on outcomes. So if you
Mm.
have leadership boards that reflect the populations they serve,
Mm.
patient outcomes are better. So by equality, I mean gender equality and race
Mm.
equality. I'm very proud of the number of BAME doctors who are in leadership positions.
Mm.
No, we don't have enough BAME doctors at
Mm.
top of the leadership
Mm.
chain. So in the lower leadership positions, in middle management, we have a lot of BAME staff. But as you go higher up, nationally, regionally,
Mm.
you have fewer and fewer
Mm.
BAME doctors, particularly in leadership positions. Now, within that, I think there is a difference. So there are a lot of Asian doctors who hold very senior national positions. For example, the director of primary medical care in England is an Asian
Mm.
general practitioner.
That's right.
But I have noticed that black doctors are particularly underrepresented.
Mm-hmm.
Make a stunning contribution, like BAME doctors in general, but
Yeah.
black doctors make a great contribution, but
Mm.
are not recognized enough, I think, and we must
Mm.
celebrate their role in the NHS, in patient care, in research, in development. So the short answer to your question is there is evidence that if leadership is more representative, it's
Mm.
better for society and is better
Mm.
for patients. You can understand needs much more.
Of course, of course. So, what do you think the barriers are for this happening? And do you think structural or racism plays a role in this? Because there's been a lot of chat about that with the current situation with George Floyd. What's your view on that?
So I think it's a very complicated issue. I mean,
Mm.
the first thing I would like to say is we should celebrate the progress that's been made.
Mm.
So, for example, I was the first BAME chairman and president of the Royal College of GPs by election. There are a
Wow.
lot of BAME doctors who have overcome obstacles and become
Mm.
national leaders.
Mm.
Um, I've heard people say to me, look, Britain is the best place to be a BAME doctor. The chances to excel, to be promoted, to achieve high position, to succeed,
Mm.
probably there's no other country in the world where you can achieve that. And I came as a refugee from Uganda in
Wow.
1992.
Mm.
I didn't have a school to go to, you
Mm.
know. I just got into university.
Mm.
I have been lucky in many ways
Mm.
and to reach to the top. But
Mm.
we need to do much more than that. I mean, I think overt racism, in my experience, I think is not very common. It does happen and it's
Mm.
unacceptable. And it's unacceptable behavior in society, in the NHS, in leadership. But I think we need to celebrate more the
Mm.
trained doctors and leaders. So things like job shadowing,
Mm-hmm.
things like mentoring,
Yeah.
like encouraging people through training, training in unconscious bias.
Mm-hmm.
So I think the more we pay attention to increasing opportunity, the better. And the NHS has very clear standards like the race equality standards.
Mm-hmm.
I think they should be implemented. We should have more data collection and monitoring. So I think there's all to play for. Uh,
Mm.
I'm shocked by some examples I hear. I don't want anybody to think that this is a small issue. This is a very big issue. For
Mm.
example, the black doctor told me, born and bred in this country, that they're often mistaken for a cleaner.
Oh dear.
That is unacceptable.
That's unacceptable. Mm.
So I think we need to do more. I think BAME doctors can offer a lot to leadership
Mm.
and to an integrated role in the NHS. And there's lots of great initiatives. I mean, for example, through gender equality, there's a 50-50 initiative by the NHS where we want to see 50% female representation on NHS boards. But I'm so proud of the medical profession. It's so diverse. There's so many Asian female doctors who are up and coming, who are rising stars. Their research is amazing.
Yeah.
There was a recent study done of British people asking them, what does your ideal doctor look like?
Yeah.
What would your ideal doctor look like? And you know what? It was a young Asian female doctor.
Oh, amazing. That's really lovely to hear. Sharing that. Lovely. So how do you think healthcare is going to change for the public now?
Okay. Well, Kesa, I'm very excited by this. You've asked me one of my favorite questions. The pandemic has taught us that there is a different way. And the different way is virtual medicine or telemedicine, which is where you see a doctor through a video. Like now, we're talking to each other through Zoom. Obviously, we had to do that through necessity because this virus, is very infectious. It's very dangerous. I would still urge everyone to take great care with social distancing, with hand washing, with wearing a face covering in the public. Very, very important. So we've had to take this model of care where we're seeing 90% of our people by video or by telephone. And we feel we can sort out a lot of problems through that. Obviously, we see people who need to come in, like a sick baby or somebody with abdominal pain. We'll bring them in to examine them and check them out. So, and the current system doesn't serve people well. I mean, look, I'm sure people will have had experience of getting difficulty in appointments, go to A&E departments, there's long waiting lists, So what the future will be is your phone, your accessing your healthcare through your phone, an app that puts you in charge. It'll be digital. The future is digital. So symptom checkers, getting help online, being matched to the right clinician, being able to speak to a GP or a nurse through video. And if you need to be seen and have a blood test and or a prescription, that's all done electronically for you. And more than that, people can now measure their blood pressure at home. They can measure their oxygen levels. You have a smart device at home, a smart watch. It can measure your ECG now, your pulse rate. Wow. It can detect if you're having a form of a heart attack or your heart rhythm changes. These things are available now. So the future is going to be digital, it's going to be fast, it's going to be accessible care, and it's going to put patients in charge of their health through information. You have data on your phone, perhaps your x-rays. Your phone can act also as a data collector, for example, measuring your ECG or your pulse rate. With attachments, it can even listen to your heart and your lungs. So, and this is not, I'm not talking about some kind of science fiction reality. This is something that can happen now. It's not widespread, but it's called virtual care or telemedicine. Right. How healthcare is going to change.
So is that happening anywhere at the moment, or is it being trialed, or?
So 90% of consultations now in general practice during the pandemic are being delivered by remote assessment. By that we mean by phone or through email consultations or by video. I know of doctors now who are helping to treat patients, say in care homes, where they have a module that takes their oxygen level, their blood pressure, takes their temperature, and the doctor can see through video what's actually happening. And that's great. Yeah, so these things are happening now. And ward runs are being done virtually, medications delivered electronically, prescriptions, the future is going to be digital. I don't think there's anything to worry about. I know some people think, well, I don't know how to use this, so this is going to be too complex. Actually, with training and support, most people are very, very used to dealing with this sort of work affected you and your family.
It's great. Thank you very much for your time. Really appreciate it. So thank you very much.
The pleasure.